Hi, I'm Dr. Nick Vogelzang. I am a professor of medicine, clinical professor of medicine at UNLV here in Nevada. I formerly was professor at University of Chicago. I am a full-time practicing physician now with Comprehensive Cancer Centers of Nevada and see patients on a daily basis. My practice is limited to mostly genitourinary cancers. I do phase 1 along with my colleagues and will also do lung cancer and a few other solid tumors. I do not do leukemia, lymphoma, breast cancer, brain tumors, head and neck, stuff like that. So I'm pretty limited to solid tumors, focusing on GU and phase 1. The immune system is a wonderfully complex system. It is composed of multiple pieces, if you will, both cellular and humoral. The cellular is a cycle, if you will, beginning with antigens, and those antigens are uptaken or taken up by the dendritic cells, which in turn present them to the T cells, the B cells. The B cells make antibodies. The T cells can make killer cells. The killer cells also can become memory cells, and the entire immune cycle is then recycled against a variety of antigens. In the case of cancer, it is tumor antigens. In the case of viruses, they are viral antigens. There are two, if you will, branches of the immune system. One is the humoral, that's the antibody, and one is the cellular, that's the T cell. There's also an immediate immunologic response, which is the interferon and cytokine reactions to granulocytes. So the immune system is extremely complex. So when people ask, what is the nature of an immune suppression? The answer is that what we usually mean by immune suppression is poorly functioning T cells. And that is what has traditionally been used as immune suppression. The problem is that many things can cause immune suppression, not just chemo, but also radiation. And being ill, just simply being ill, causes immune suppression. So that is what is meaning to say immune compromised or immune suppressed. We don't know that answer yet. A history of cancer is not known. It depends on how long ago the cancer was. If you recently were treated with chemotherapy or radiation or surgery and were in the hospital, that might increase your risk of complications. But if it was 3, 4, 5 years ago, the answer is no. If you finished your chemo or radiation 3 or 6 months ago, the answer is probably not. But many things are still unclear about what this virus and what our immune system and how our immune system interacts with cancer and the virus is, much of this is still vague and unknown. Well, oral cancer therapies are not generally considered immune suppressive, but the exact drug that you are on matters. So there are many drugs. I do prostate cancer and give patients hormone treatments. To our knowledge, the hormone treatment pills have no effect on the immune system. On the other hand, my colleagues who treat leukemia and lymphoma give oral therapies, and those therapies can definitely lower the immune system. So it is highly dependent upon which drug and which disease you are being treated for. Well, cancer therapy is many things. It could be surgery. It could be surgery with radiation, surgery with radiation, with chemo. It's just a broad question, very, very broad. And the only advice that we have given in writing is in the up-to-date publication. That up-to-date is available in almost all hospitals. It is a website and a software that is constantly updated. The only advice that we in the genitourinary field have given is it's probably reasonable to not do chemotherapy if it can be avoided during this epidemic. That's the only advice we can give. But we don't want people to delay treatment. We don't want people to not have surgery. I this last week recommended 4 or 5 people undergo surgery for their cancer. And in spite of the COVID epidemic, the cancer needs to be treated. I have many patients who are getting radiation, and although my radiation colleagues have been nervous about this, I've said, we need to treat the cancer and the cancer needs to be eliminated. Therefore, proceed with radiation, even if this COVID epidemic is ongoing. The questions are, again, about the side effects of the detection technology. So if you're getting bone marrow biopsies, no, that shouldn't be a problem. If you're getting x-rays, that should not be a problem. If you are getting blood tests, that's not a problem. But, you know, some people might be getting more invasive things like a tube put into their bladder or other maneuvers that may, and again, I want to be very careful here, they may increase your risk of some infections. But I would not recommend that these be delayed. A regular, careful pattern and schedule of monitoring needs to be continued no matter what your COVID data are showing. If it's high or low, you still need to be monitored for your cancer